Hi everybody, it is Dr. Jones, and here we are with our week 2 content. So this is learning the language of medications because medications are a language that we have to learn to speak and be fluent in. And this week we're going to do the cardiovascular foundations. There are many other cardiovascular medicines that we will talk about starting next week, but for now we're going to be focusing on 4 classes: ACE inhibitors, angiotensin receptor blockers, beta blockers, and diuretics. So last week we talked about organizing our pain medications into families or classes, and this week we're going to be doing the same with cardiovascular. So the good news here is that cardiovascular meds have some of the strongest naming patterns in all of drugs. So if you learn these patterns now, you can use them throughout. You're going to see these drugs for your entire career. These are our learning objectives: recognizing beta blockers, ACE inhibitors, ARBs, and diuretics, talking about the broad mechanisms, and then the major naming patterns. So we're not having to memorize doses or a lot of strong details. This is just building a familiarity. You can spend all of the time that you want in fluent practicing these and getting more familiar with them, spelling the drugs. That's really important. Spelling does matter. If a word is spelled incorrectly, then it is counted incorrect on your tests. But you need to start recognizing these naming patterns for these classes. So, for example, these 4 drugs, we have metoprolol, atenolol, bisoprolol, and nebivolol. So you can see what they have in common there. They all end in lol. And the number of times I have said this and the number of times people still miss it is always surprising to me. And so let's make sure that you have this down now. This is a pattern. So I can tell, if you show me any drug that ends in lol, I can tell you automatically what class it belongs to. So these are all beta blockers, and I'm going to say all these words for you so that you can know how to pronounce them. Bisoprolol is Zebeda. Atenolol is Tenormin. Metoprolol succinate is Toprol XL. That one is an extended release. That's the difference. Metoprolol tartrate is Lopressor. Nebivolol is Bistolic. Carvedilol is Coreg. Propranolol is Inderol, and labetalol is Normodine. So every single one of these are a beta blocker. So the big picture on a high-level view, beta blockers reduce the effect of epinephrine and norepinephrine on your cardiovascular system. So we're not going to go deep into pharmacology. We have time for that later. But remember, right now, the main thing you need to know is they lower the heart rate. They lower the cardiac workload. That's how much your heart is having to work. And then as a result, it lowers your blood pressure. So here's an example. Metoprolol comes in 2 different salt forms. When you see 2 words, they're different salt forms because they just are. We call them salt forms. And so metoprolol succinate is Toprol XL. That is the extended release. It is taken once a day, and it is indicated for heart failure. But metoprolol tartrate, or Lopressor, is taken usually twice a day, and it is not indicated for heart failure. But for now, you also just mainly need to know that there are 2 salt forms of metoprolol, and you will need to know the different brand names for each one. This is another really important stem pattern. So we have 2 ACE inhibitors here. ACE inhibitors work on the RAS system, the renin, angiotensin, aldosterone system, which is mostly related to kidneys. And so these lower the blood pressure by blocking the conversion of angiotensin 1 into angiotensin 2. You'll learn more about that next semester. But what you need to take away from this is if it ends in pril, so we have enalapril or Vasotec and lisinopril. It has 2 brand names that are used, Prenavil and Zestril. If you see this on the drug quiz and I ask you for the brand name, you only need to provide one of them. Either one of them would be counted correct. Big picture mechanism of action, I told you here a second ago. It reduces the production of angiotensin 2 or the conversion of angiotensin 1 to angiotensin 2 by the angiotensin converting enzyme. And that ultimately lowers your blood pressure. This is a first-line treatment. Lots of people are on this. Next, we have angiotensin receptor blockers, and these work in a different spot on the same pathway. So if ACE inhibitors blocked the production of angiotensin 2, ARBs, or angiotensin receptor blockers, block the angiotensin 2 from hitting the receptor. So it's the same pathway, just a different stop on that pathway, which is why you would not take both of these together. So we have losartan or Cozar, candesartan, Atacand, olmesartan, Benicar, telmisartan, Micardis, and valsartan, Diovan. And if it says sartan, it's always going to be an ARB. Here's the mechanism here. I just said this. It blocks the angiotensin 2 receptor so that it cannot bind, which in turn lowers blood pressure. So sacubitril valsartan, this is a combo medication. It is only used in heart failure. Entresto is the brand name. So you have two different classes in this. So valsartan, just like we saw before, is an ARB, angiotensin receptor blocker. And then we have sacubitril, which is a neprilysin inhibitor. And that's really all you need to take away from now. Just know that this is a combo and it is called Entresto. But you see that sartan there, you know that that is an ARB. Our next class is calcium channel blockers, amlodipine, and there's also like nifedipine, there's a couple of other dipines. Those are calcium channel blockers. That's Norvasc. Then we have diltiazem or cardizem and verapamil or Calin. There's a few finer points between these, but for now you just need to know that they're all calcium channel blockers. Calcium channel blockers are in your arteries. So we have calcium channels in our arteries because our arteries have smooth muscle in them, which means they can get too tight. And so this blocks the influx of calcium into those calcium channels, and it helps your arteries become less rigid, which helps lower the blood pressure. But that's all you need to take away for now. Next, we have our diuretics. A diuretic's job is to remove excess fluid from the body. And if you think about your cardiovascular system being like a water pipe or a water hose, one of the ways you can lower the pressure on that water hose is to have less water in the hose. So if you have less fluid in your blood, in a good way, what it does, it also removes some excess sodium and that sort of thing. So there's a few different ways diuretics work. We have multiple diuretic classes, and they all work in the kidneys, but in different places in the kidneys. You'll learn more about that later. But we have our thiazide diuretics, which are hydrochlorothiazide, which you'll normally we call it HCTZ, and then the brand name for that is hydrodiaryl. The other thiazide is chlorthalidone or hygroton. And then we have a combination here. We have triamterene and HCTZ, which is diazide or maxide. The HCTZ is the same as it was in the first one. And then triamterene is actually a potassium-sparing diuretic. So that's a combo medication with two drugs in it. Then we have our loop diuretics, furosemide or Lasix, and torsemide or Demodex. And then the next one it's a potassium-sparing diuretic, but it's also called a mineralocorticoid receptor antagonist. So it's the same thing. It's two different ways to explain the same mechanism, but that is spironolactone or aldactone. So if you see a class potassium-sparing diuretic, it could be triamterene or spironolactone, but if you see mineralocorticoid receptor antagonist, it's going to be spironolactone. From our drug list, there's also another drug in that class, but it's not on the drug list, so don't worry about that. Big picture, I think that I said that already. They help the kidneys remove excess fluid from the body so that there is less blood volume. So a lot of people will call it their water pill. Some of them make you pee more and some of them don't. But we'll talk about that later. So if you take nothing else away from this week, you need to take away these naming patterns. If it ends in LOL, it's a beta blocker. If it ends in pril, it's an ACE inhibitor, and if it ends in sartan, it is angiotensin receptor blocker. Yeah, you're going to see these your entire career. So go ahead and lock these in now. So as you are using Fluent this week, I want you to focus on pronunciation. You can use the pronunciation checker in Fluent on the fluency track. Practice your brand and generic spelling. That's also on the fluency track. And then our class recognition, like I just said before with our naming patterns, knowing what class any of these drugs are in. So look for the patterns, and that will help you be successful. And I just wanted to remind you that the worst way to study pharmacology is staring at the list. Like, you could do that, but it's not going to help you learn it any better, because that is such a limited pathway in your brain, this visual recognition. You're going to be able to do better than that. So your brain needs repeated exposure to these drugs. You need to spend time in Fluent every single day, a couple of lessons. You don't have to spend an hour on it every day, but every day you need to be logging on and spending some time, 10, 15 minutes, or as many as you want. And please, please, please say these drugs out loud, because being able to say it in your head is only one way of learning it. When you say it with your mouth, you create muscle memory in your body, and it becomes easier to say it. Pronunciation improves retention. And I'm going to say it now, and I'm going to say it 100 more times. Don't practice until you get it right. Practice until you can't get it wrong. I believe in you. You're going to do great. Happy studying.